a space where beauty meets authenticity and transformation is not just a possibility, but a promise. I'm absolutely thrilled to introduce you to someone truly special, Dr. Rukmini Rednam, the compassionate force behind the countless remarkable transformations in the vibrant city of Houston, Texas. Picture this: every curve, every contour crafted with care and expertise, not just by a board-certified plastic surgeon, but your very own cheerleader for self-discovery and confidence. Get ready to embark on a journey where we explore the art of science of feeling your very best self. This isn't just a podcast. It's your cozy corner of empowerment and inspiration. So pull up a chair, pour yourself a cup of kindness, and let's dive into the Confidence Doc podcast with Dr. Rukmini Rednam.
Welcome back to the Confidence Doc podcast. My name is Dr. Rednam, and I am a board-certified plastic surgeon in the Houston area. For those of you who are new listeners to us, I am part of my Houston Surgeons. We are a multi-specialty practice with both plastic surgery, facial plastics, and ENT. And I'm saying this today because I have one of my sinus surgery partners on today, Dr. Shawn Allen. Welcome to the show.
Hi, thanks for having me on today. Glad to be here. I'm Dr. Shawn Allen. I'm a board-certified otolaryngologist with a fellowship training in rhinology or sinus and skull-based surgery.
So many of you are asking, what does that have to do with plastic surgery, right? Isn't this a plastic surgery podcast? And we're going to talk today and explain to you how these two specialties actually have a whole lot in common. But before we get into that, Dr. Allen, why don't you tell our listeners a little bit about what brought you to the field of ENT?
So I really liked intricate surgery, and a lot of ENT surgeries have to do with small but complex areas. They have to do with multiple senses. For instance, in your nose, you got your sense of smell. It also is part of the airway, so there's a lot of functional airway surgery that we do. When it comes to sinus function, this plays into immune system and allergies. So it's kind of one of those playgrounds where a lot of functions in the body kind of coalesce in one little area where you can make a big impact on quality of life that has to do with different conditions, but in the end kind of figure it all out and make those patients suffering from everything from a little stuffy nose to obstructive sleep apnea breathe better and live better lives.
That's awesome. So it sounds like you really like the layers that are involved with this type of surgeries.
Exactly. I think there's a little of investigation aspect to it on some level.
What kind of training did you have to go through to get to where you are right now?
So after undergrad, I did 4 years of medical school and then 5 years of ENT residency and then a 1-year rhinology fellowship.
So what is rhinology?
So within ENT, there's a lot of different aspects, everything from facial plastics to peds and tubes and tonsils to head and neck cancer. So rhinology specifically is everything that happens on the inside of the nose, and that includes how you breathe through your nose, sinus function, and particularly complex sinus that maybe the standard ENT isn't as good at addressing. And it also includes skull-based surgery. So that's working in partnership with a neurosurgeon to approach things through the nose that otherwise would have required big craniotomies a few years before.
That's really amazing. I think a lot of people have no idea that you would be involved with that type of a surgery.
Yeah, that's actually what drew me to rhinology. The skull-based component is really, really interesting. It's not something I do a lot of these days because outside of academics, it doesn't come up as much. But when I was training, that really drew me in and captivated me. And now I'm focused more on the quality of life things, I would say.
Very interesting. So why don't you tell our listeners a little bit about your particular practice? So, you talked about quality of life things, but I still think that a lot of people would say, ENT, so you do tonsils? So what specifically do you see patients for?
So as a rhinologist, I'm particularly good at helping folks that have nasal obstruction symptoms. So this is the obvious daytime obstruction. It's the obstruction that only happens lying down at night. The snoring patient, the patient that feels like they just have a crummy quality of sleep because maybe their nose is congested. Mm-hmm. That's on the easier end of the spectrum. And then on the tough end of the spectrum, I've got patients who have had 10 sinus surgeries that keep failing because they're not quite done, I would say, to the standard that a rhinologist can deliver versus what a general ENT can deliver. So having the skills to do extended sinus openings for those really tough cases can really make a difference if somebody feels like they're having sinus work done and it's not really panning out long term. the right surgery and good ongoing care is really what makes a difference for those tougher customers.
So, do a lot of people need sinus surgery, or is this something that can sometimes be treated with medication only?
I would say if you have chronic symptoms, meaning like well over 3 months in duration, like stuffy nose, drainage, post-nasal drip, sinus pressure and headaches and things like that, there's a good chance that medications just aren't going to cure those conditions. Now, if you get a cold and an obvious bacterial sinus infection, you take around antibiotics, usually you can kick it with just a round of antibiotics in that situation. But the underlying cause of all this is often allergies and anatomy problems. And if the allergies plus anatomy problems overwhelm what your body can just keep normalized inside your nose, often surgery's role is to just create better openings, better drainage pathways, access for better therapies that can get in the nose topically so you can keep doing them safely over a longer period of time and manage the inflammation and the allergy component of the disease better than what you might get from just allergy shots or allergy drops.
So I'm curious, this may be a question you have an answer to, may not, but do you think that allergies have been getting worse over time? Obviously, the anatomy is our anatomy, right? But like, I feel like when I talk to people, a lot more people nowadays are like, well, I'm allergic to this, I'm allergic to this. And so I'm just curious that if you've seen this, if this is something that is real, that we are noticing more and more people are getting worse and worse allergies.
I think there's strong evidence that pollution and our sterile practices essentially are contributing to allergic and possibly even autoimmune disease. So this is as simple as we wash our hands a lot more. We don't play in the dirt when we're children as much as we used to. Fewer people maybe have pets, bringing in outdoor pollens and antigens on their fur. So all of those things that, rewind 50 or 100 years ago, everybody was exposed to those things, and hygiene wasn't what it is today. So their immune systems developed in response to that to be able to manage a lot of insults constantly coming in. And now that we're so clean, the insults aren't there to help program our immune system. You end up with more allergic disease, which is essentially our immune system reacting in an overreactive way to things that maybe it just identifies as a pathogen because it's not exposed to enough to develop properly, if that makes sense.
That's so interesting. We're too clean now.
Exactly.
I knew it.
It's a plus and minus, I guess,
Yeah,
ups and downs
yeah.
to that one.
So, well, common things that you see, like say you go to the store, you walk in the pharmacy aisle, you see a whole aisle now of these bottles to irrigate your nose, right? So can you talk a little bit about that? What's the purpose of these?
So cleaning your nose essentially gets rid of dust and pollen and all of these immune stimulants that are just sitting on the lining, triggering that immune response. So the nasal rinsing devices, everything from a neti pot, which is the oldest, to the squeeze bottle, which is probably my most preferred method, to the new powered devices, which suction rather than push. So there's a lot of options out there, and they all do the same thing in the end. They just work differently. So I have some patients that, for instance, when they're squeezing on the bottle, it pushes into their ear, and they might even get ear infections every now and then. So those are a good example of somebody who actually does really well with a suction machine like the Navage. The other thing to consider with those different devices, head position is very important, especially if you've had sinus surgery and your intent is to clean sinuses. You have to keep your head down and in certain positions to actually reach the sinuses with the rinse. If you're upright, like with the Navage, it may just clean off the nasal airways, but not even reach the sinus areas you're trying to clean. So those are other factors. I actually made a video on my YouTube channel about rinsing and head positions and how all that can be targeted to achieve specific results for different sinuses.
So out of curiosity, why isn't this something that our bodies naturally do? Why is this something that we now have to, or that we've started doing a lot more of?
I would say that really comes down to the allergy issue and the immune issue. So one component of allergy are the histamine symptoms we all know, the sneezing, the itching, the dripping mucus. The other component of allergic disease is all inflammation, and this is where you get swelling of the respiratory lining. It may just be the nose, or it may be all the way down to the lungs and contributing to asthma. And in the nose, the natural sinus drainage pathways are 1 millimeter or so. They're very tiny, so it doesn't take a lot of swelling to obstruct a sinus, essentially turning it into an abscess. It makes mucus constantly. If that mucus can't drain and you have bacteria already in that sinus, it's not hard to develop a bacterial sinus infection just from that obstruction. So viruses do the same thing. You swell aggressively during a respiratory viral illness, and those blocked sinuses, if they don't quickly start draining, get a bacterial infection in some cases.
I mean, I've been on the other end of it. You've been my personal doctor as well. So I see the value in it for sure. I think it does freak people out a little bit, but it's amazing what you're able to achieve with technically a very simple tool.
Right. And that comes down to, if somebody fails medicine, they're looking at procedure options. Now we have a balloon device for sinuses, for balloon sinuplasty. And it's a much less invasive way than traditional sinus surgery. For those cases that are appropriate for it, it can be very effective to dilate the openings, and it does remodel the bone, so it can be permanent. Steroid stents help keep that opening more open, so we're able to achieve really good results like we used to have to do big surgery for, but with a less invasive, much easier and faster procedure now.
So can you explain the balloon a little more? Because in my brain, I'm seeing like a balloon at a kid's party in someone's nose.
So think of it as a guide wire, which is passed into those tiny holes, and they're angled for the different sinuses. We can use image guidance and kind of track the wire, make sure it gets into the right position. And the balloon is on the wire and can be advanced. So as you advance the balloon, it's deflated initially. You advance over the wire into that opening till you can confirm where it's at, and you inflate it, and it's actually a very sturdy balloon, so it can crush air cells in the bone, in those air cells that make up those paths along the sinus drainages. And as it crushes those cells, it's enlarging that opening. And most of the balloons are 6 to 7 millimeters in diameter, so you go from a 1 millimeter hole to a 6 or 7 millimeter hole just by inflating the balloon there.
Is this a procedure that you can do awake, or is this something you have to be asleep for?
Traditionally, it was done awake. However, and in my experience, and every ENT I'd say has a different experience, I can deliver much better results if patients are adequately sedated. There is a numbing process that can be used inside the nose, certainly, to allow these to be done awake. And if somebody is unhealthy and doesn't want to do anesthesia, that's certainly something I would offer. But if that patient's sedated and I can position the balloons without worrying about patient discomfort or address a deviated septum at the same time, it just delivers better outcomes. And I'm always going to recommend that if that's an option.
Okay, well, I mean, it's pretty neat. You must be pretty good at video games. It sounds like something that you really have to put a lot of skill to turn around those corners.
So a lot of staring at the screen. So I think the hand-eye coordination and being able to watch a screen while you manipulate things on the inside of the nose is a key skill to becoming a rhinologist for sure.
Yeah, because you definitely have to be thinking in different dimensions when you're doing that.
Yeah.
So I think one thing that I think that's always interesting about plastic surgery and ENT is that what a lot of people don't know is that we were one specialty at one point, right? So the same father of plastic surgery is also considered one of the fathers of ENT, Sir Harold Gillies. Like a lot of things, this all happened during wars, right? So wartime. And there was a point where plastic surgery and ENT split off simply because things became more specialized in each direction. Right. But there are times when plastic surgery and ENT work together still. I don't personally do rhinoplasties, but I know you work a lot with one of our other partners, Dr. Balin.
Yes.
So when you guys do combinations, what's the role that each of you kind of plays?
So I have more of a functional breathing role in these cases, and these are patients that often have a combination of outer deformity, meaning the nasal valve area, which is also a functional component of the airway, or cosmetic concerns, dorsal humps, maybe their tip needs reshaping for cosmetic reasons, or they have congenital deformities or defect from cancer. And so Dr. Balin can address the outer portion of the nose through a rhinoplasty approach, including nasal valve widening if that's part of what they need. And I work endoscopically through the nostril to address the septum, to address the turbinates, other areas like the sinuses if they're also showing problems on imaging, which is always a part of the workup. And by doing it together, there's some advantages. One anesthesia instead of spread out into two anesthesias with two surgical facility fees and two anesthesia fees, you can combine that in one and have a real cost savings a lot of times. Less exposure to anesthetics, and the recovery feels very similar whether you have one or both of those. So if your plan is to have both, you don't really want to go through two separate recovery periods. So it makes sense to try and fold it all into one when you can.
Yeah, I think that's always one of the benefits of being a group like ours is that we can kind of work together on for certain procedures to provide those skills. So it is true because at the end of the day, the nose does have an external and a very large internal component, which we don't see on a regular basis, so we don't always think about it, right?
Right.
So another thing that you treat that is quite a hot topic, which you briefly talked about earlier, was snoring. So can you explain to our listeners exactly what are the common causes of snoring?
So think of snoring as airway turbulence. So when the nose or any part of the airway constricts, it could be from nasal congestion issues, deviated septum, turbinate hypertrophy or enlargement. The air has to speed up because you need a certain volume of air with each breath to feel like you're breathing normally. If you're breathing through a smaller and smaller airway, the air goes faster. As it goes faster, it becomes more turbulent, and it actually generates more of a vacuum in the throat, which collapses the floppy areas like the back of the palate and the tongue base against the back of the throat, even worse than if you were wide open in your nose. So these are often patients that start out with a little nasal congestion, and maybe their normal body mass and obesity is not a problem. And then over time, that nasal congestion translates to beating up the palate, which elongates it, and pulling back on the tongue with that vacuum effect. And over 5 or 10 years, they develop sleep apnea, even if it just started as snoring, because of the airway alterations that are occurring that are progressive over time.
Oh, it's like you're slowly being eroded.
Yeah, unfortunately, that noise reflects trauma, essentially. So if you are snoring, it's not normal. We've normalized it as society because it is so common, but unfortunately, it does not reflect normal breathing. And if you ignore it, it may take 5 years, it may take 20 years, but eventually it's going to lead to something more significant than just snoring.
So can snoring be treated surgically then?
It can, but we always work up a patient that comes in for snoring for possible sleep apnea and for their nasal anatomy problems.
Okay, so what's sleep apnea?
So obstructive sleep apnea is what most people have if they have sleep apnea, and that is essentially a pattern of obstructions that are happening enough that it's impacting their sleep cycles and their quality of sleep. And we consider that 5 events per hour, like either an obstruction. So that obstructive sleep apnea is 5 events or more per hour on the mildest end of the spectrum. And on the severe end, it's upwards of 30 to 100 events per hour.
Wow.
And when you're having those obstructions, several things are happening. 1, you're not breathing properly, so your oxygen levels can drop. 2, your cardiovascular system responds with a adrenaline response saying, hey, I need more oxygen, and your heart beats faster and your blood pressure elevates and your brain starts to wake you up to get you breathing again. So you're not getting deep sleep when that happens because you need sustained calmness essentially to achieve REM or deep sleep. And without that, you start feeling tired and you start falling asleep easily during the daytime and have mental fog, memory issues. So those are kind of some of the signs once it's more advanced.
So snoring really can be the sign of a lot bigger things happening that can really affect your life negatively.
It can, and it's not always. You can have primary snoring, which is the absence of sleep apnea, but still having some noise at night. But it's worth getting a home sleep study, if nothing else, because nobody that I've encountered has been very good at determining if they have sleep apnea or not, because the real warning signs happen while you're asleep. So there are spouses or partners that sometimes give them feedback. You know, you're stopping breathing at night, you're gasping for air, you sound like you're choking. So those are cues that you need to get to the doctor. Because if those things are happening, there's a very high likelihood that you have some degree of sleep apnea.
Yeah, so if your spouse is snoring, don't just slap them. Like, maybe at the moment, but there's actually something more you need to be looking into. It sounds like it's a lot more serious than people realize.
Absolutely. And I'll be honest, guys tend to be pretty stubborn when it comes to these sleep issues. So it often takes a good, several years of encouraging them before they'll make that choice. What I'm trying to do is help educate so that they realize, okay, this has got some side effects I don't want to deal with. Maybe I should get this looked at while it's easier to manage, because it gets harder to manage if you develop more severe sleep apnea.
Yeah, so like most things, it's like, don't sit on it. Like if you know that you're starting to have these issues, it never hurts to come out and like get a proper evaluation and make sure that
Absolutely.
what's going on, right?
It's not hard, and it's definitely not very expensive to get a home sleep test, and that tells you what you need to know as far as urgency.
What are some other conditions that you treat regularly?
So post-nasal drainage, I would say, is one that comes up a lot. That nagging drip down the throat, that it might be allergies, it might be sinuses. Sometimes it's vasomotor, meaning it's just a drip, but there's no allergies present, and we attribute it to nerve dysfunction inside the nose.
Interesting.
That's one. So sleep, we mentioned sleep apnea, and one of the things that I operate on for sleep apnea has to do with CPAP intolerance. So the gold standard treatment for sleep apnea for many years has always been a CPAP machine. And there's variations on that, different masks. The problem with that, the tolerance is around 50%. It's not very good. And if you're unable to use that, a lot of people just give up and they throw it in their closet, and years go by where they're having health problems and not doing anything about it because they just assume that's the only option.
And for our listeners, if you've not seen a CPAP machine, it literally fits over your mouth and is giving you this continuous positive pressure, right? And so it's not always the most comfortable thing for somebody to have on.
Right. And especially for the younger patients that, are still in the dating scene and things like that. There's a lot of excuses I've heard over the years.
It's worse than a mouth guard. It's worse than a mouth guard.
So what I would encourage those people with is there's so many good options and alternatives to CPAP now. Everything from better oral appliances, which you just wear like a mouth guard at night, to the newer Inspire implants and other things in the pipeline that might be like Inspire as well, that essentially move your tongue with a little electrode and implant.
Oh, neat.
So those things are helping the non-CPAP patients who can't tolerate CPAP achieve similar results and actually manage their health in a positive way instead of just ignoring it because they don't want to use the CPAP.
So so the Inspire sounds really interesting. What are some other things coming down the pipeline that you're really excited about in your specialty?
Well, something more recent with these new GLP-1 agonists, I believe is what they're called, like semaglutide or Ozempic. They've actually shown a lot of promise in treating sleep apnea. And
What can't these medications
I know.
do?
We might all be taking them at some point, the way things are looking at this point. But by helping reduce insulin resistance and improving metabolism, improving weight loss in particular, you're actually easing some of the aspects of the throat that are having obstruction problems. So there's one physical measurement that predicts severity of sleep apnea, and that is neck circumference. And a lot of these patients that have ignored it and letting it get more moderate or severe, they tend to have a little excess weight here. And that might be fat, it might be bulky muscles in their neck, whichever the cause. When they lean back and that weight is pushing up on the tongue, it contributes to how much the tongue goes into the throat and obstructs the airway. So that's just a theory, but maybe the GLP-1 agonists are actually helping reduce some of that burden pushing back on the tongue.
Yeah.
Maybe the sides of the throat, which have planes of fatty tissue, are helping melt away some of that fat and opening up the throat a little bit. So I don't think it's been studied enough to know exactly how it's improving sleep apnea, but I'm anxious to see, as they do more of those studies, how effective it really is, and if it's a medication option for sleep apnea above and beyond what we're doing with machines and surgeries for sleep apnea.
That's amazing. I think that both of our specialties, we're obviously, I consider us rather invasive. Surgery in general is, but we're always still excited when there are options that come up that help our patients treat conditions that don't necessarily have to require us.
Yeah, absolutely.
Well, Dr. Allen, sorry, you were going to say something.
Well, it's one other great example of a medication helping replace the need for surgery. So in the world of sinus patients, some of the worst are nasal polyps. These are patients that have next level inflammation, and if they don't use a lot of steroid therapy, their nose can literally fill with polyp disease that obstructs their nose and contributes to sinus and all kinds of problems, worsens their asthma. And a newer medication, Dupixent, which is injected every other week, has literally shut that problem off for a lot of patients. They don't all need it or qualify for it. There are plenty that do well with steroid sprays and steroid irrigations, But the ones that used to be in the operating room every 3 to 5 years to get cleaned out, when you put them on Dupixent, it's like a miracle drug. They just normalize and become normal patients again. And it's wonderful seeing that, because it wasn't even available when I came out to practice about 9 years ago.
That's
it's
amazing.
kind of a newer development.
Sounds like it's really life-changing for those patients.
Absolutely.
Well, thank you so much for being on the show today, Dr.
Sure.
Allen.
Really enjoyed it.
How would our listeners find you?
So I'm with my Houston surgeons. We have an office in the Woodlands and in Houston. So you can call our practice if you'd like to see me. I also have my own personal website with contact information on there, and that is premiersinus.com. And, of course, my information is on the myhoustonsurgeons.com website as well.
And I'm going to tell you about a hidden talent that Dr. Allen has, and that is that he is a musical magician. And so you need to check out his Instagram as well. And will you share your handle?
Sure. So I'm on Instagram and TikTok as Snot Doc Texas. So if you want to find some of my educational material, but also some of the less educational stuff, like some music stuff that I've done, you can find that on Instagram or TikTok or even YouTube under Snot Doc Texas.
So it's really cool stuff, and he makes something that, not a lot of us know about, really interesting. So definitely check it out.
Thank you.
Well, thank you so much for joining us on the Confidence Doc podcast today. And thank you so much to our listeners. Stay tuned for next week for the Confidence Doc podcast. You will not want to miss out.
As we wrap up another episode of the Confidence Doc, I want to extend our heartfelt thank you for being a part of our community. If today's conversation resonated with you, remember that Dr. Rednam and her team are here to support you on your journey to self-confidence and beauty. Your story is unique, and it's our privilege to help you create the masterpiece that is your life. If you'd like to book a consultation with Dr. Rednam, you can visit her webpage at drrukminirednam.com. Fill out a contact form, and one of her coordinators will get with you accordingly.